Okay, good afternoon, folks. Welcome to our town hall for Thursday, it's the 22nd of October. And I see Wendy calling up her screen there with Halloween pictures. So it's a good reminder. So thanks so much for joining our town hall for the McMaster Children's Women in Children's Program, Mumsy, Ron Joyce sites. Really glad to see everyone again. I'm Bruce Squires. For those who I haven't met yet, I'm President of the Children's Hospital, Vice President of Women and Children's Health, and really love to have these town halls. We are now moving to a bi-weekly schedule, and we did cancel last week, really in follow-up to advice that we had received from the previous survey, where folks noted how difficult it was when we had town hall happening on a day concurrent to the HHS town hall. So I think we're back in line now. They are a little bit unpredictable in terms of when HHS town halls happen as well. So we'll certainly monitor that closely. But right now, our preferred and approach is to go with these town halls every second week. Starting with evaluation, I'll share my own evaluation first. I love this opportunity to talk to you and to receive some comments both in advance and in follow-up. I don't love the fact that they're not particularly interactive. And they're not in person, so I long for the day, like I know most of you do, where we can spend more time together in the same room, and it's a little bit easier to go back and forth. But in the interim, again, from my own evaluation, I really truly appreciate this opportunity to talk with you. In terms of your evaluation, from the last time, we had about 77% saying it was a valuable use of your time. We had a few that were in the neutral, and a very small number saying it wasn't worthwhile. We received some feedback with respect to timing and with to frequency, and so we have adjusted the frequency. And on the timing, it does still seem that this is the best time of day. But I want to stay flexible on that. And by the way, I also want to stay flexible on whether in fact we might need to have a couple of different mechanisms that could even possibly have some opportunities that are more site specific in supplement to what happens through walkarounds and through CQI mechanisms and huddles, etc. So I'll just plant that seed as you give feedback as well, and always kind of welcome your advice as we continuously approve and adjust this one piece, and it's only one piece of how we're trying to support all of us with information, with action, and hopefully with a form of dialogue. So let's jump right in, because some of the things that folks identified as one topic for me to discuss at the next town hall, I think are really good for that, and important things we wanted to share. So let me jump into a couple of these things. One here is wanting to ask about current policy is that parents and family members do not need to wear masks when nurses and other healthcare practitioners are in the room. We provide close contact care for an extended period of time. Why are families and patients not required to wear a mask, as is the bylaw everywhere else in the city? So that actually is something that is actively being addressed by our health and safety team, working with as we speak. So again, this relates to caregivers, essential caregivers of inpatients. Certainly, some of those caregivers are in the room for 24 hours with their sick child. And so we know they may not, it may not be reasonable or possible for them to be masked at all time. Certainly, we are, and when providers are entering the room, they absolutely will ask and should ask and encourage the family to don a mask. Should that not be possible, then as always, our teams are encouraged, as individuals, we're encouraged to use a point of care risk assessment. And if further PPE beyond what you're already wearing is appropriate, then that absolutely should be provided. So that's sort of my quick summary on but we're going to have more communication out to help, more education, I guess, and support to teams on how to deal with that question. Another kind of topic folks wanted to hear about was with respect to flu shots. So flu shots, proactive provide the community with an outdoor venue on campus, drive-through or tents perhaps. This would signal how important flu shots are this year and would assist the community. I can't agree enough. And I know that I'm a little bit of a broken record along with members of your leadership team in bringing forward and promoting those ideas at public health tables with Hamilton. I'm sitting at the Hamilton COVID response table chaired by Public Health, and have members of our team sitting on subgroups, including the immunization subgroup. There are certainly kind of logistical challenges in public health in moving to add new mechanisms, new flu shot clinics, if you like, for the delivery of flu shot to patients and families. And so we're having to work through those. But I want to say to this group again, absolutely, my goal would be to see us able to more actively participate and assist in the provision of the flu vaccine across the community. It's in the broader public health interest, and on a narrow perspective, it's certainly in the interest of us as child and youth health providers, including from a capacity perspective. The fewer kids that are getting sick, from influenza, the better prepared we are to deal with the many other health challenges. And there's a third piece, right? So the less flu that's circulating in the community, the less of us that may be getting sick. And we all know that when we're sick, that's worrisome, but it's also a pressure on our colleagues to step up to support the continuation of care. So let me close on that piece to really encourage all of us to take advantage of the fact that Employee Health Services is available to administer flu shots to all of us, including for them to visit units. Ideally with a commitment of a group of at least 10 who are saying, yeah, this is a good time, let's come, but that's available to us. If you saw, I don't know, if you don't like shots, I used cocoa as my mechanism to kind of comfort me through the fear of a vaccine. So if anybody would need support, I know that my COVID would be glad to come and support you through that. So last thing I'll say on flu shots is, for sure there's some logistical challenges in the community with respect to timing and availability, but nonetheless, it is appropriate for all of us to be advocates for the value of flu vaccination to particularly to children and youth, but also to the entire community. So please do that. And I hope to have more to share around our capacity and ability to support that delivery going forward. Next piece, and kind of related, some questions around COVID in the community, and absolutely appropriate, and then leading into questions around COVID testing and swabs being done at MCH because of the lack of testing and appointments in the community, COVID numbers, and finally COVID testing updates for our family members when we may be forced to stay at home or may have challenges in coming to work because of kids that have been sent home. So let me start with COVID in the community. Hamilton has certainly experienced an increase in the spread in the community. Very large piece of that was driven by one outbreak at SpinCo, but also there are certainly a growth in the number of outbreaks. Most of the outbreaks, be they in businesses, be they in a couple of restaurants, and be they in schools and long-term care homes, have really been limited to very, very small numbers, 1 or 2. So that's been fortunate, with of course the exception of the SpinCo outbreak. And so what we are really seeing at this point in Hamilton is that public health measures and perhaps just the approach of the community has so far allowing tracing and isolation to happen, identification, tracing, and isolation to happen relatively quickly, so that we're not getting the same level of spread as being experienced in really our neighboring communities to the east. But that of course is a risk that's being monitored very closely. So we would really be at medium risk in this community. So critically important that we continue our practices in in supporting all of the public health measures. Moving to testing and assessment. So yeah, 2 weeks ago, in particularly, we were experiencing a significant challenge in this part of the province, and actually the whole province, with turnaround times for even getting testing and assessment, and then in follow-up in getting results of those tests. And so we experienced a fairly brief but a significant spike in the number of folks that were coming to the McMaster Children's Hospital Emerge, really because they weren't getting testing for their symptomatic children quickly otherwise. Those turnaround times have improved. So fortunately, that both has helped in getting results more quickly, getting tests and getting results more quickly for the entire community, but also for us as staff and physicians. But it's also reduced the volume of folks presenting to the Emerge when an assessment center may have been appropriate. However, we don't know if we might go back there again. So I hope folks noticed yesterday, and certainly want to celebrate the fact that we've moved as HHS to having a stream not only for rapid testing for each of you as members of the HHS team, but also for your symptomatic family members. The details were communicated last night in the HHS update, but certainly, the way I understand it is when you're in that situation, you dial the 42200 number, and you essentially go off in 2 streams in terms of pressing 1 or 2, and each of them direct you to rapid access to you or your family members to rapid access to testing at the assessment center at the UCC. So that is something, honestly, that was driven very significantly by members of our team, noting the importance of that, again, to your well-being, the well-being of our teams, and again, to our ability to ensure that folks come to work. So a huge thank you to Sarah Kahn in particular, and to so many others in helping to support that. And while we may not find that the other mechanisms are a challenge right now, so the more broadly available access to the testing centers, but as the second wave progresses, there's certainly a possibility we may again find a greater pressure and a greater need to use that approach. So glad to see that we have that, and big congratulations. Let me do a couple more of the topics to address. If we say we are promoting staff health and October is Healthy Workplace Month, why can't staff have the incentive to walk, bike to work by saving on parking? To do that now, you have to lose your spot in the garage. It would be the healthy thing to do in a lot of ways. So in terms of giving up parking spaces, that's not something, and we have raised it. That's not, and being able to maintain priority, not something we've been able to operationalize practically across the organization. I have taken it through forward previously, and we've just not been able to access that. So I'm going to continue to explore that, but I'm afraid we're not able to do this at this point. I have a question about workspaces. I work at the RJ, and our workspace has been converted into swing desks, where everyone picks a desk for the day and sits at it. With us being expected to work on site more and more, do you anticipate when we may go back to having our own assigned desks? I find it difficult not to have my own desk to store supplies and client information files, or to plug in my laptop to the docking station, as they have different connections. I also feel that from an infection control perspective, it makes more sense to have an individual assigned desk as opposed to everyone rotating desks every day. That's a great question, and there, some really good considerations in that question. There are teams corporately right now, and across our individual programs, that are working to think about what is the appropriate approach to conducting our work both during the pandemic and going forward. That relates to questions around how much can and should we continue to do from home where possible. So how much is work from home appropriate? How much do we anticipate doing virtually, including with care for patients, and how do we really facilitate that in our space? How do we really optimize our use of space, technology, and time going forward? And so to me, what our workplaces of the future may look like is undoubtedly going to be different from what it is right now. And so we at least have to consider whether that notion of flexible workspaces is both practical and allows us to maximize space for other uses. And so, I don't have an end point on this. On the matter of infection prevention and control, very important that, and I do believe we have mechanisms to ensure safe wiping down, et cetera, of shared workspaces. And so just encourage you, if there's a piece around the shared cleaning of a workspace, and that of course is touch surfaces, please raise that up with your manager. So, no endpoint on this yet, or no end answer yet on this, but a dialogue I hope we continue to have. Let me move to a couple of other questions. We have many questions in the outpatient clinic from parents about the screening process. What is asked? Will they be turned away for a runny nose, etc.? Some patients and families travel long distances and don't want to risk being turned away, but also require care. Is there a resource for parents to self-screen at home to better understand when to stay at home and when to attend an appointment? For example, if they have only a runny nose but no other symptoms, would they pass screening? What is the threshold? And I really appreciate the opportunity on this question, because I think we may have I don't think we may have. I'm sure we if you like, over-rotated early on in the course of the pandemic, where we were quick to postpone care in what we believed was, understandably, the interests of ensuring health and safety for patients, families, and for our own teams. The fact is, we have mechanisms to ensure that, so that only in the most extreme circumstances should we be canceling or postponing care, particularly at a time where the majority of our care is being delivered after long breaks, after delays, after the work of a backlog. So very reticent to postpone care when the alternative is just to take additional measures. So we're not turning away patients from appointments. When there are precautions required, which can be determined through the screening process, then we're able to support those additional precautions. And so we are encouraging, and I think teams have to continue to be supported in providing the information to patients and families with respect to the screening process, and ensuring that we're supporting our teams in communicating with screening and with clinics when those circumstances arise. And part of that is what we have on the website with respect to screening. So I really want to support that question, and we have to continue to really CQI our processes to facilitate those circumstances. But you would have seen, hopefully many of you, Dr. Karen Bailey from the radiology department, heavily in the media this weekend, talking about how we still have a significant number of cancellations that are happening. And those cancellations have, unfortunately, real implications, like no-shows. They have real implications for the health of the children and women and families we serve. And so it's in our interest to try and prevent that. On that note, I do want to have a little bit of a celebration here that folks may not know. We have made some really great progress in raising the alarm around the need for focus and attention to addressing the care that's been delayed or canceled or postponed or has faced obstacles due to COVID. Funding announced to address the surgical backlog, with very specific funding directed to pediatric surgeries, including at this hospital. We're still working out how to utilize that, but government, the public has heard our call. Yesterday there was announcements with respect to child and youth mental health services, and with respect to eating disorder services, again with targeted funding. So that is good. Now that doesn't mean that it meets all of our needs, but to my point, I believe we're making progress on this. We've had 2 additional NICU beds and an additional PICU bed that have been added. Again, reflecting the need for the services that we provide. And those teams have worked to implement those additional beds. So, announcements like these bring challenges, and they certainly have their limitations. We're not there yet. I would reflect that they are some positive momentum, and to me, it really just, if you like, reinforces our need to continue to advocate for the patients and families that we serve, and for your ability to serve them. Let me just get to a couple of the last questions. So my question is with regard to the security that have been placed at the underground parking areas. On several occasions, I've been told or seen people have not been screened. They have come in through the staff entrance or walked into the elevator area and went up the elevator without being screened. Notice the security are sitting in an area where they can't see people coming in. Sometimes no one at all is even there. I think if you are spending your time looking down on a cell phone or reading a book, this leaves room for missed people coming in. I was wondering if there was a way to keep the staff sides locked and only have the entrance with badges as it is that way at the front. Perhaps have a plexiglass divider in the visitor side to block the elevator area off so people don't bypass the screening process. Don't know if there's a better way to make this work, but it's amazing how many people are still able to enter without following the guidelines in place. So this is a confusing question in some way because clearly some of those people may be university staff, staff and physicians who self-screened. We have security there actually for helping to support crowd control. They're not there for screening. And unfortunately, the vestibules are a little bit of a less than ideal space. Have looked at whether we would add badge access to some of the other entrances, the stairway entrances, but there are health and safety reasons why we can't do it for those areas as well as the cost. You know, it's a helpful question. I do want to then follow it with one of the first celebrations. So I just wanted to send in a celebration to share with the team and any future Ask Bruce Town Hall to celebrate Kevin, who's the non-HHS security working regular daytime shifts the front doors of MCH. So friendly, warm, and helpful, and makes for such a positive patient, visitor, staff experience. He also contributes greatly to maintaining smooth flow for screening with his calm, welcoming, and informative approach. Thanks, Kevin. That's not to in any way diminish the important signals in the previous question, but it is to really highlight and say thank you to, in this case, the members of our security team and Kevin being a wonderful example. To echo that out to those who have worked in screening, both on the redeployment basis, and to which again I say such a huge thank you, and to those who have taken it on as brand new careers. So with that, I'm going to close. With respect to celebrations, I just want to point you, if you happen to have a chance, you would have received in my email our newsletter today, and I shared in that newsletter a series of 4 of the many compliments that I receive. I have the privilege to receive in my position about the services and particularly about the people across the organization that we receive from patients and families. So these are the voices of those for whom you care, talking about how much they appreciate and value the work that you do. So I really would encourage you to take a look there. As we close then, I do want to take the opportunity to quickly do a draw. And this week we have a donated $25 Tim Hortons gift card. And just to remind folks that that Ron Joyce and the Ron Joyce Family Foundation, huge catalyst and supporter to our Ron Joyce Children's Health Center, to our 3Z Child and Youth Inpatient Unit, to our Foundation for Healthcare Improvement. That's related to Tim Hortons, so that's a connection to folks that you may or may not know. So, going to celebrate Janet Gray, a business clerk in the pain clinic. So, Janet, gonna pass this on to you, and gonna do a couple of other draws, which will be for the M&M, to Leah Costa, an NP in chronic complex care. So nurse practitioner Leah, thank you and congrats. And lastly, oh wow, so NP week. So Robin Stevens, NP also in pediatric medicine. So congrats, and a great opportunity to say thanks to our NPs and to our business clerks. So with that, folks, thank you so much for joining this week. Thank you all for everything that you do to support kids and families, colleagues, and look forward to seeing you again and talking soon. Take care.